Hello, doctor. My name is Harry Lafferty. I represent Pennsylvania Tube and its insurance carrier in workers' compensation litigation initiated by Jonathan Cash. Before we get started, could you please state your name for the record?
Julia Black, MD.
And I'd like to ask you some questions about your qualifications. What is your educational background?
I have a medical degree from the University of Guatemala. After that, I did an internship and residency at the University Hospital in Pittsburgh. In 1986, I began a private practice in neurosurgery in Pittsburgh. I am also board certified in neurosurgery, and I serve as a full professor of neurosurgery at the University Hospital Medical School. I have also published approximately 300 medical journal articles on neurosurgery and 3 textbooks.
That's impressive, doctor. Could you please estimate what percentage of your treatment involves the treatment of low back complaints?
My practice includes approximately 50% spinal surgery and 50% brain surgery.
Could you also estimate what percentage of your practice involves medical legal work, such as IME examinations?
About 5%.
Now, doctor, at the request of my office, did you perform an evaluation on Mr. Cash with regard to this litigation?
I did.
And at the time of that examination, did you obtain an oral history from Mr. Cash about what he claims happened to him?
Yes, Mr. Cash told me that he was in the course of his employment and he was jarred by a conveyor belt. And after that happened, he felt pain in his lower back and going down his right leg.
Did you also perform a physical examination on Mr. Cash?
Yes, I did.
And what was the result of that examination?
Mr. Cash's complaints were inconsistent and did not conform to what you would expect anatomically.
Could you go into a little bit greater detail about what you mean by his complaints were inconsistent?
Yes. For example, Mr. Cash, when asked to raise his leg up off the table, complained of severe pain. But when he had that same leg in a down position as he was sitting on the table, and I asked him to move that same leg, he had no complaints of pain.
Okay, doctor. Did you also, in conjunction with your examination, review various medical records that were provided by my office?
Yes.
And were there any records of significance that you reviewed?
I reviewed his medical records and the records of Dr. Wright, and also records of treatment with a chiropractor prior to this incident, at which time he complained of pain in his back.
Did you review diagnostic films, including an MRI examination that was taken of Mr. Cash shortly after this alleged incident?
Yes, I reviewed the actual films.
Okay. Based on your review of those films and your review of the records that were provided and your physical examination and the history provided to you by Mr. Cash, were you able to reach an opinion as to what the source of his present complaints is?
Yes.
And what is your opinion?
It is my opinion, within a reasonable degree of medical certainty, that Mr. Cash suffers from degenerative disc disease and a decrease in the water content of his discs and also arthritis. And I can demonstrate on the model of the spine that we have here that actually Mr. Cash has deterioration of his discs throughout his spine. And this would be the cause of his lower back pain and pain going down his right leg.
That diagnosis that you just described, is that a diagnosis that's related to the work injury that Mr. Cash is claiming to have sustained?
No, there was insufficient force. The problems that Mr. Cash has are related to the aging process.
Thank you, doctor. Those are all the questions that I have. Ms. Bailey is going to review your file, and then she'll have some questions for you as well.
Hello, doctor. How are you doing today?
Very well. Good morning.
Good morning. As you know, my name is Justine Bailey, and I represent Jonathan Cash. Doctor, in the records that you reviewed that predate the date of this injury, you'd agree that nowhere does it indicate that Mr. Cash had right leg complaints.
Yes.
And doctor, you would also agree with me that a trauma can aggravate a pre-existing degenerative condition.
I agree with that, except that in this case, there was insufficient force to cause that condition.
And that's your understanding of what that force is?
Yes.
Doctor, in the records that you reviewed, would you also agree with me that nowhere does any other provider indicate or suspect that Mr. Cash is engaging in symptom magnification?
I agree that that does not occur in the medical records, but I found that Mr. Cash's complaints were inconsistent.
Doctor, you agree that pain is subjective, correct?
Yes.
Now, before this deposition started, as I was waiting for you out in the waiting room, I took a look on your side table, and you have a whole bunch of pamphlets there. And I saw this pamphlet that you, I assume, put out for your patients, where it indicates that an individual can sustain a trauma to their low back with forceful twisting. Is that accurate?
That is accurate. However, based on my review of all the documents in this case, there is no objective proof that Mr. Cash had the force necessary to cause that type of injury. The mechanism of injury is just not sufficient in this case.
Doctor, you've only examined Mr. Cash on one occasion, correct?
That's correct.
And that was December 20th, 2011?
Yes.
And before this deposition started, I had a chance to review your file. Is that correct?
Yes.
Okay. And in that, I noticed a letter from Mr. Lafferty to you scheduling, asking you to evaluate Mr. Cash, and enclosing all of his medical records. The letter also summarizes all of the medical records given to you. Did you actually read all of the medical records?
I did read most of Mr. Cash's medical records, but Mr. Lafferty knows that I am considered one of the top neurosurgeons in the country, and he was trying to save time for me, and so he provided me with a summary, which I did use.
So do you agree that if Mr. Lafferty's summary is inaccurate, that could cause you to change your opinions that you've rendered here today, correct?
It could, but I have no basis to conclude that Mr. Lafferty's summary was inaccurate.
On direct examination, you also indicated that about 5% of your practice involves legal work and IMEs.
Yes.
Okay. About how many IMEs do you do a week?
About 5 per week.
And another thing I noticed when I was reviewing your file was an invoice that you sent to Mr. Lafferty charging him $2,000 for your evaluation. Is that the standard charge for an IME?
That is, but that also includes the written report.
That includes the report, but doesn't include your testimony here today, does it?
That is correct.
And that's a separate charge that you will be billing Mr. Lafferty for.
Yes.
Okay. So you do 2,000, or you do about five evaluations a week at $2,000 in evaluation. That's $10,000 a week, doctor.
That is correct, although I do not do those exams every week of the year because I have 5 weeks of vacation, and about 6 weeks of the year I spend traveling around the world presenting papers on my research.
That still leaves over 40 weeks left in a year. So, that's over $400,000, doctor, you make on legal evaluations. Good for you. I have nothing further.
I have no follow-up questions. Would you like to read or waive?
I will read.
Very
Is
well.
that an extra charge to Mr. Lafferty?
No. I have to be extremely accurate in everything that I do.